Hey there, future nurses. It's Kristine from Nurse in the Making, and today we're going to talk about everything you need to know before starting nursing school. We'll start with what you should do, what you should buy, all the way to your first day at nursing school orientation. Before we dive in, remember to grab the free nursing school prep guide. This guide covers everything you need to know to start nursing school strong. I'm going to cover a lot in this video, but there's so much more information that you can find in the free nursing school prep guide. You can find the link to this free guide in the description below. If you're watching this video, congratulations, because it probably means you are accepted into nursing school, and this is not an easy thing. You should feel extremely proud of yourself, although I know you're probably more nervous at this point. This is completely normal. I remember my emotional roller coaster of realizing my dreams of becoming a nurse was coming to life, but at the same time, I was scared, nervous, and excited. Worst of all, I had no idea what to expect. But don't worry, we're gonna cover everything you need to know. First things first, let's talk about preparing before classes start. There are some things you can do and intentional steps you can take to prepare for your nursing school classes. These things can really help you set yourself up for success. Staying ahead is so important in nursing school. So let's go through a little checklist that you can check off before you start classes. First one is meal prep. This is a great time to pick a handful of easy meals that you can make throughout nursing school. My crock pot was my best friend in nursing school. You can also start meal prepping and putting things in your freezer. The first week you'll have a ton of information thrown at you, so if you can have your meals covered, it would be one less thing to worry about. Next is automate your life. You want to make sure that your bills and your appointments are all set up before starting nursing school, because I promise you'll be super busy. You don't want to have to worry about mailing out different bills every month, so set things to automatic payments. You might think you have time to make doctor's appointments and pay your bills every month, but time flies by, so automating these things before can really help you save time and stress. Next is cleaning and decluttering your living space. This might be a personal preference, but if my house is a mess, my brain is a mess also. So take this time to organize and declutter your closet, your house, your backpack, your computer files, pretty much organize everything. It will help you start nursing school with a completely clean slate. Next is setting up your study space. You want to make sure you have a designated spot in your house to study. This should be away from noise, and if possible, it shouldn't be in your bedroom. That way you can separate school and life just a little bit. The goal is to make a super clean and decluttered workspace so you can easily focus on what you're studying, not what you need to clean up. I love my dual monitor screens because I can have my book on one side of the screen and my notes on the other side of the screen. You can find the link to my study space setup in the description below. Last but not least is shopping for supplies. You have to find what you like, look at reviews, and mix it up. Choose different colors for different topics. Get some colored highlighters and some binders. The more organized and streamlined your supplies are, the more you'll feel the exact same way. Next is a content review. I get asked this question all the time. I'm about to start nursing school in a month. What should I review now before starting nursing school? There are definitely some things that you should review before starting your classes. Doing these things will help you get a head start. You can even do this while you're sitting at the beach, traveling back to college, or waiting for dinner to be cooked. So these things you should absolutely know before walking into your orientation are lab values. Lab values will appear in every single class, all the way from med-surg, mental health, to mother-baby. I have a worksheet on lab values in the free nursing school prep guide. I'll have a link to it in the description below. Another thing to review is dosage calculation and med math. Almost every single school will require you to take and pass a dosage calculation exam to stay in the program. Other things like electrolytes, acid-base balance, IV fluids, and common abbreviations are super helpful to know before you start nursing school. Being familiar with these things will help really set you up for success. Now, if you're watching this video and you're about to start nursing school tomorrow and you haven't reviewed these things, don't freak out, it's okay. You'll have some time in the next few weeks to start reviewing these topics. Next is orientation, and I'm not talking about the orientation that you go to for your prerequisites. I'm talking about nursing school orientation. This is a thing you do before starting your nursing school core classes and clinicals. This will most likely be a very long day. For example, mine went from 9 a.m. until 4 p.m. with an hour lunch break. This is where your school is going to tell you exactly what to buy, what to wear, and what to expect throughout the program. My advice for this is to be present, take notes, and even record parts of the orientation if you're allowed. Let's walk through some practical things they might talk about in your nursing school orientation. The first thing is the dress code. Your professor will most likely give you the dress code for sim lab and clinicals. Listen closely to these. Most schools are extremely strict when it comes to these things. Just a little side note and tip that you should definitely buy 2 or more sets of scrubs they require just in case you have clinicals back to back. You don't want to come home from a long day of clinicals at 8 p.m. and have to do laundry before your next shift at 8 a.m. Next is your clinical schedule. Your instructor will talk about your clinical site, weekly schedule, and your assigned unit. Usually what schedule they give you is what you get. There are so many students to accommodate that most likely you're not going to have a say as to when or where your clinicals will be. Next is the class schedule. You're probably going to feel extremely overwhelmed. No. You 100% will feel extremely overwhelmed when you get the schedule. You will literally be able to see every single exam, quiz, lab, assignment, and clinical that you have to be at for the next 4 to 5 months. It will feel very overwhelming. I always say the day of orientation, don't plan on doing anything after. You're gonna wanna have time to debrief and breathe and take it all in. So this long schedule that you will get, I suggest that you get a really good calendar and write everything down, and I mean everything. Before every semester started, I would do this, and it would take me about an hour to 2 hours to really transfer it into one organized document, but I promise it will save you so much time, so don't skip this step. Next is books. You will get a long list of books that are needed for your first semester classes. Some professors will live by the book and some professors might not. Everyone teaches a little bit differently, but either way, have your books on hand and be ready. You don't want your teacher on the first day to say, everybody come back tomorrow reviewing chapter 1, and you're waiting weeks to get your books. So if your teacher doesn't use it, you can always return it. Last but not least is the expectations that your professors, friends, and other nurses will talk about. They will say how hard nursing school will be, and it's true in some sense. Yes, it's very difficult, but remember that nursing school is a marathon, not a sprint. Remember, you want this, you are capable, and you're running after your why. In the free nursing school prep guide, I have a little bit of a worksheet where you can write down your why for each semester. I know for me, the reason I wanted to do nursing kind of changed and evolved throughout my semesters as I gained experience in clinical, simulation, and lab. So be sure to grab the free nursing school prep guide and go ahead and journal your thoughts. That way, when you feel overwhelmed and you feel like quitting in moments, you can refer back to that chart and remember why you're doing this. Next is clinical attire. We touched on clinical attire a little bit during the orientation part, but let's talk about some practical things you can buy for your clinicals. Your school may have a specific color they require, or they may provide you with their own clinical scrubs. Like I said above, buy 2 or more pair of scrubs just in case you have clinicals back to back. Your school may provide you with a nursing school stethoscope, but I personally had a hard time hearing with my school stethoscope, so I would suggest buying and investing in your own. You can use it throughout nursing school, but you can also use it as a nurse on the floor. I personally love Littmann stethoscopes. It's definitely a really good investment and it's worth it. For shoes during clinicals and sim labs, you may be required to wear a certain color, probably black or white. They may have to be wipeable or washable, like a leather material, because you never know what's gonna get on your shoes during clinicals. Compression socks will save your calves and your legs. I personally didn't think I needed these in nursing school because I'm a runner, but that doesn't mean anything. Your legs will ache after a long shift. I promise these are a must. Make sure you ask your school what color your socks need to be because they may not allow fun or colorful ones. Some clinical instructors may be very adamant about your hair being in your face, so having cute headbands to pull back those flyaways is a must. You will most likely not be allowed big jewelry in clinicals, maybe some small stud earrings, a wedding band. That might be all that's allowed. My school didn't let us wear smartwatches at clinicals, so I needed to invest in an analog watch. You can find cheap ones on Amazon that do the job. So other accessories and miscellaneous tips are things like medical safety scissors. These scissors have a dull edge with a thin blade and are perfect for cutting gauze, bandage, and tape. You'll use these all the time, so come prepared. If you're asked to perform a task, you want to have these on hand. It's a great idea to have a bag just for clinical use. That way you aren't pulling things out, forgetting necessities at home. It's a designated only for clinicals. Buy something medium sized to fit a change of clothes and all of your items, and something easily washable. Clinical days are long. You may have the option to buy lunch if your facility has a cafeteria, but Packing a healthy, balanced lunch with protein and some extra water gives you more time to sit, eat, and absorb all this new information that's been thrown at you. There are a million and one things to remember during your nursing school clinicals. Clinicals can be very overwhelming with the amount of information that's thrown at you in one day. Having reference cards at your fingertips will be a huge help. Another tip is to avoid long artificial nails. Most schools will probably not allow these because they can harbor a lot of bacteria. Some schools might allow clear polish, but again, they'll cover all of this in orientation. The next tip is bring extra pens, extra hair ties, extra tissues, water. Feeling prepared will help you feel more excited. I promise you would think that there's a lot of pens on the floor, but pens are like gold in the hospitals. They're a rare find. That is so true. Next is some tips on how to get the most out of your clinical experience. My first tip would be to ask for a tour of the supply room on the floor you're working at, especially if you're on that floor the entire semester. You want to ask the CNA or a nurse, hey, could you give me a quick tour of the supply room when you get a chance so I know where to find everything? But a little side note is to make sure you ask during non-busy times. The beginning of the shift, the end of the shift, or when receiving a new admission is probably not the best time to ask. Next tip is to carry a notebook. You'll be taught a ton of information and will remember it best by writing. This shows your dedication to learning, but will really help you at the end of the day review all of the information. Think about interventions, why they're done, and things like lab values. Just make sure no personal patient information is written down on your notebook. Next is be honest and give a baseline. You want to tell the nurse that you're working with on the floor what you've been reviewing in class and what your skills are. Let them know what you'd like to see, try to help with, or learn more about. Don't expect them to know. This will help them and will help you see and learn a lot more. If an opportunity arises to watch or perform a skill, ask to be a part of it. Remember, we all started out as nursing students and great instructors will respect and build off that. Last but not least is don't be shy. Definitely easier said than done, but the preceptors, the providers, and the patients, they know that you're students. Introduce yourself, communicate with your patients, ask questions, and absorb all the information that you can. If something seems confusing, just ask. Don't pretend to know everything. Let's talk about dealing with comparison. Nursing school is extremely competitive. Admission and acceptance is competitive, and life inside of the program is no different. You'll probably feel that tension right at the start at orientation. And I don't say that to scare you. I say that to make you aware of this because it's a trap that you don't want to fall into. Remember, you're not the same person as the one beside you. It's easy to compare yourself to others, but can also impact your personal confidence. Everyone studies differently and everyone has different weaknesses and strengths. So be yourself and focus on you. The last thing I want to talk about is tips for dealing with bad grades or failing an exam or class. I wish somebody would have told me that this was more common before I failed my first exam and thought my life was ending. Passing is important, but one low grade is not the end of the world, and neither are a few. It's easier said than done, but give yourself a bit of a break, take some deep breaths, and don't let it change your state of mind. It's really important to know your school's grading scale. This is probably very different than your prereqs, and it varies based on what school you go to. This will most likely be brought up and talked about during your nursing school orientation. So how do you deal with failing an exam? First off, I want to say that I have failed many exams. These tips are what I found worked best for me when I failed a nursing school exam. The first step is to give yourself space to be upset. Trust me, I remember this all too well. I would cry and get sad and discouraged. After you fail an exam, take a break from studying for at least a day or half a day. Go do something that brings you joy and rest. The key here is to recover and get back quickly. Channel these feelings towards studying and aim to pass next time. Regardless of what grade you get, as long as you pass nursing school, you will become a nurse. Next is reevaluate your study habits. If you are continuing to fail exams, you're gonna wanna reevaluate your study habit. You can't keep studying the same way and expect to just magically understand the information. You have to find a study method that works best for you. This may take time, so be open-minded and be patient. You will find what works for you. Next is ask your professor for advice. This may seem very scary, but don't let that fear get in the way of you asking and seeking for help. You can simply send an email to your teacher requesting for a meeting. During this meeting, the teacher will most likely go over the exam with you, which can be very helpful. I've done this with teachers that I disliked and teachers that I liked. You can ask for extra credit, maybe retake options and study tips and advice. Not every teacher will be accommodating, but it's worth asking. This will also show them that you're determined and committed to passing and learning. Always go into these meetings with humility, professionalism, and willingness to learn. I wrote a little mock-up email you can use. Hello, Professor Smith. I'm currently taking your pharmacology class. I failed the most recent exam and would love to set up a time to meet with you to go over how I can study better and if you have any study tips. Thanks so much for your time, Kristine. So in this email, there's no fluff, there's no complaining about how the exam was unfair, and there's no darts thrown at your professor. Again, humility, professionalism, and a willingness to learn. I hope these tips were helpful and give you a little bit more peace about starting nursing school. There's a lot of things that I didn't cover in this video that's in the free nursing school prep guide. You can grab the free nursing school prep guide and any other products that I mentioned in the description below. Best of luck to all of you starting nursing school.